So, Stacy, I have a question.
Yes.
Are you ready to say goodbye to dry eyes?
I am so ready to say goodbye.
So, Dr. Seal, why don't you start the procedure you're going to do and kind of talk us through what you're doing?
Certainly. Go ahead and close your eyes and look down.
Okay.
Thank you, Stacy. First, we're going to put a little bit of opaque tape over her eyes themselves so that the intense pulse light that we use, the bright light, which is just visible white light, go ahead and look down again, close your eyes, won't affect her eyes themselves. The way we treat this condition is by using bright visible light over the surface of the eye, and mostly just the lower eyelids and the skin of the face. And what it does, you'll feel a little tingle right here.
Okay.
Did you feel that?
Yeah, I did,
Good.
but it wasn't
I'm going to watch and see that it takes in, and it's taking in nicely. Keep your eyes closed like you are.
Okay.
This visible light energy will be absorbed by the abnormal blood vessels, and therefore they will themselves be resorbed. The inflammation they bring will therefore be gone too, and the oil glands will start to produce a more natural oil as a consequence of that. As the natural oil is produced, it seeps from the largest oil glands in the face, which is the oil glands in the eyelids themselves, into the tear film, and the tears don't dry up so quickly. They don't evaporate so quickly. So people notice that the redness starts to go away, and their dependency on eye drops starts to go away. The problem with using eye drops for dry eyes, it's kind of like licking a chapped lip. It only has a very temporary effect because it's not going after the source of the problem. The source of the problem in this case is insufficient oil in the tear film. So if you use the artificial tears too often, whether it's stuff designed to get the redness out or the dry sensation, it can actually make the condition worse, and the excess moisture that comes from them can wash away the natural nutrients over the surface of the eye.
So how many treatments would you need to get resolution?
We would normally do about one treatment per month over about a 4-treatment session. Women get dry eyes about 2 to 3 times as often over the course of time as men do.
So obviously Stacy isn't going to feel any immediate effects from this, but we actually do have a patient of Dr. Seal's in our audience, Leela, who's been through the treatments. So Leela, what do you have to say?
Well, it's been great because every time when I wake up in the morning, I don't have to worry about wearing the eye drops. My eyes do not burn or get dry anymore. They don't get red, and I'm able to wear my contacts again.